Kaushali from the medical team of USV, and I welcome you all to yet one another episode of CME India, where this time we are going to discuss about what the physicians must know about rabies. And without further ado, let me have the honor to introduce the person behind the CME India drive, none other than Dr. N.K. Singh, sir. He's a director, Diabetes and Heart Research Center, Dhanbad, Chairman RSSDI Jharkhand, and ex-governing body member of National API, having numerous publications to his credit. Without further ado, I would like to hand over the session to Dr. N.K. Singh, sir, for the further proceedings.
Thank you, Dr. Arsil. So from the USV team. So welcome our viewers, our esteemed audience. I think today's session will be very exciting. Every day we discuss rabies. Every day new questions come up. So I think I welcome our today's speaker, Dr. Suresh Kumar. I think in India nobody needs details about him. He is doing a great job by starting a WhatsApp group also, ID 100, I think. So, and welcome Dr. Akash Singh also. He is the expert also today. And we have got two panelists, Dr. Bhanu Pratap Singh from the, can you display the PPT slides of Dr. Bhanu? And yeah, so he's did his MBBS from the DMCH Bihar, MD from the Darbhanga, and then so many, you can see the courses, life member of API. He's working today as consultant physician at Siwan, Bihar. And Dr. Pratik, I think, can you display the slides of Dr. Pratik? Yeah, so I think he will be just joining. He's the DNB General Medicine infectious disease physician in the Surat. I think he has also doing very great in the infectious diseases, and especially in dengue. And basically, he is doing a great work in infectious disease physician. He has done MBBS, DNB General Medicine, and in the Surat Clinic of Infectious Diseases and Adult Immunization, Nanpura, Surat. So welcome, Dr. Pratik. With that, Dr. Bhanu Pratap, can you introduce our speaker today?
Sure. Can I go for that slide?
Yeah.
Slide, please.
Also, I forgot to tell all about Akash Singh. Can you display first the Akash Singh slides? So I think every time you have heard about him, about his current designation at Baroda, chairman of the IDCM, principal authors of many publications, reviewer, and so many achievements. So we welcome Dr. Akash Singh, and now you can display the slides of for the CB slides of Dr. Suresh Kumar. Yeah, Dr. Bhanu Pratap Singh.
Thank you, N.K. Singh sir, for giving me this opportunity. And Dr. D. Suresh Kumar sir needs no introduction, but it's customary to introduce him. He is a senior consultant in infectious disease and very good clinician. He has many awards and honors. And without going details, I would like to hand this mic to him. Dr. Suresh Kumar sir, please.
Welcome, sir.
Thank you, sir. I sincerely thank the CME India and particularly Professor N.K. Singh sir for giving this wonderful opportunity. And I know whatever initiatives I'm asking, and I forward it without any hesitation. Sir is forwarding to all the groups and helping spreading the knowledge. And based upon the CME India group only, we started the group and we started focusing on infectious disease. Sir is focusing on medicine overall. We are focusing infectious disease alone. Thank you for the wonderful opportunity, sir. So next 30-35 minutes, I'm going to discuss a lot of things commonly people are asking about rabies there. So whatever things commonly asked to me, I'm just putting it here with evidence. What evidence is there right now? I'm putting it here. Before that, my disclosures, I'm an ID talk. Definitely, I'm not going to bite your boring presentations today. It will be interesting for you people to know and practice the animal bites history, not only rabies, animal bites, how we are going to handle in the practice. So I'll begin with the cases only there. I'm not going to bore you with this. This is a young lady while going for a walking in a Marina Beach. That's common in Chennai. So when you're walking in a Marina Beach, she was bitten by a horse. The horse was handled by a small guy. Usually the horse are handled in the beaches by a small boys. They bring the horse and they want to do the horse riding. When they bring the horse bitten her, this lady. So this is a bite mark of the horse. So the boy immediately ran away with the horse. She does not have any comorbid conditions. On examinations, This is a site, and she's not having any fever, nothing. Immediately after the bite, came to your emergency room. Does she need any PEP, post-exposure prophylaxis? I want the participants to put it so that we can discuss at the end. How many say yes? This is a horse bite, still I need to give a PEP. No, this is only horse bite, doesn't require PEP. Or maybe I do not know, the bite is a significant bite. Or give injection TT plus immunoglobulin of equine based, because this is an horse based bite. So I want to give equine based, not human based. Follow the horse for 10 days. Usual dictum, we has to follow the animal for 10 days, whether the animal is live or not. Whether this rule applies to the horse also, we need to check. So please go ahead and vote so that we can discuss at the end of our presentations. A lot of questions I'm going to ask you, so you can keep answering it so that our panel can discuss at the end. So why we are discussing, before we say what we need to know, why we need to know. India is common. Rabies is quite common. Particularly animal bites is also more common. Almost all the streets, for example, where I practices in India, Chennai, almost in Chennai, all the roads has got 2 or 3 stray dogs. If you go in the night time, particularly by two-wheeler or even by walking, the dogs will chase you in the night time or early morning there. So people are going for early morning jogging, or people coming in the IT department, working in a IT sector where they came little late by two-wheeler, definitely the street dogs will stay you. They start will go behind you and bite you. Sometimes they threaten, sometimes bites also you there. So animal bite is quite common because stray dog populations and cat populations also more, but more of stray dog, that's more concern for us. Apart from the thing, people going for temples, for example, most of the temples contain monkeys. Monkey bite is also quite common. So these animals are behaving. Of late, last 1.5 years, almost bizarre bites by cow, bullock, most of the other animals also start biting people. So this is a status, and more number of deaths happening compared to any other country. Not only bite is more important, that death due to rabies is also more common. That is why we are discussing today. If you see the map, most of the Asian countries, that is why Western traveler coming to the developing country, they are taking the rabies as a prophylaxis vaccines. Why? Animals are also common, stray dogs is also common, and third thing, the bite and death is also more common. That is why we are discussing today and choosing the topic. For example, if you see India, almost all the states are reporting animal bites as well as rabies, except Goa. We need to check why the Goa is not reporting. That's the only thing there. But if you see the social media, daily social media, whether you are aware or not, social media is aware of it and keep on telling people died of rabies even despite taking vaccinations. A lot of messages keep putting in the social media. That is why we are discussing. So the first part, why we are discussing, India is endemic for stray animals. The chances of stray animal bite is very quite common, and death due to rabies is also very high compared to any other country. That is why we are discussing one. So coming back to this case, does she need PEP or not? So what you are going to do? Any bites or any animal bites, we need to know how to approach a case. That's what I'm doing with. So how to approach this case? So rabies is basically a viral encephalomyelitis. It's a viral encephalomyelitis. It's caused by Lysa virus. It spreads through infected saliva as well as bites by the animal, because the bite contains the saliva. Sometimes people say it's only scratch, it's not bite. Why I should take the thing? Yes, most of the rabid animals start licking the nails. Start licking the nails, so the nails also contain the virus. Even the scratch can transmit the rabies virus to you. I'll come back and show a couple of case scenarios and couple of FAQs people commonly ask me there. So rabies is basically a encephalomyelitis caused by Lysa virus, transmitted by not only by the bite but also by the scratch as well as by the saliva. If it come in contact with either non-intact skin or mucous membrane exposure, it's possible there. Almost all the mammals can carry these viruses. Rodents, the chances of carrying this virus is unlikely. For example, this case people always says, this is one of the case encountered me there. This is bitten by a pet kitten, not even a cat. This is a kitten bite on the face. And she said she was playing with the kitten and she provoked the kitten. She separated the kitten from the cat. So the cat is staying with her, and kitten, she wanted to separate the kitten and provoking the cat. Following the provocations, the kitten bit her in the face and particularly in the lip. What will you do now? This is not a stray one, this is a home one, not even a cat, this is a kitten only. And it's bitten by because of the provocation it was underwent. So what will you do? How many people say, I don't want to take chance, I want to give rabies vaccinations. Not only rabies vaccinations, give immunoglobulin also. Don't forget TT also needed. No, only TT is enough, and give some antibiotics. And the last part is suturing the thing, because the wound is bleeding and it is happening in the face and it can create an ugly scar. So whether you want to suture it or not, these are the things we need to discuss. So next question people keep on asking. We know all mammals carry the Lysa virus. Chances of getting rabies is very high. Rodents carry chances a bit low. But what about the kitten or puppy? People always say this is a puppy, this is kitten. Up to 3 months, even they are not vaccinating the kitten and puppy because mother is transmitting the immunity to the kitten or the puppy. But unfortunately, the mother should have immunity to transmit. I do not know whether the mother cat has got immunity or not. We're not sure about it here. So these things should be given. And one interesting article I come across, what is provocations and unprovocations? Even walking past the dog, we are not doing anything that's called provocation to the cat or animal, dog. Just walking past the dog. That's what happening in the night time. Most of the IT employees working in the late night, walking or passing the two-wheeler, just past the animal. They say this is a provocation to the animal. I do not know why provocations. Similarly, unless the animal is bizarrely behaving, it's very difficult to say whether it's a provoked or unprovoked. A lot of things they put about provoke, but for me, all it's unprovoked to me there. That is why if you read the Indian guidelines on rabies, clearly says don't ask whether it's a provoked bite or unprovoked bite. It is very, very, very difficult for us to say which is provoked bite and which is unprovoked bite. It's bit clear. So the history is very unreliable. Whether it's provoked or unprovoked, it's very, very vague one. And second thing, people say this dog is vaccinated, this cat is vaccinated. But people are vaccinating once, whether they're giving the booster shots for the vaccinations for the cat or dog, we do not know. Second thing, during the time of COVID, everybody knows. After taking the COVID vaccinations, almost most of the people, they develop COVID. That means vaccines can give immunity, but it's not going to give 100% protections. They prevent the severity in everything. So, for example, like dog or cat received vaccinations, it needs booster, but how many people maintain their records, I'm not sure. But not all vaccines is going to give immunity. Following hepatitis B vaccinations, healthcare workers, they are not producing sufficient titers most of the time. Not most of the time, some small number of people, they are not developing immunity for hepatitis B vaccinations. COVID time, most of the people, COVID vaccines, not protected the COVID. So, according to the Indian guidelines, the history of vaccination is also unreliable. So, whether provoked bite or unprovoked bite, whether the animal is vaccinated, not vaccinated, is not bothered. So, what is bothering you? We need to know what sort of animal it is and what sort of bite it is. That's only going to decide whether I need to give prophylaxis or not. So, according to the Indian guidelines, as I told earlier, most of the mammals is they're vulnerable. Rodents are not vulnerable. For example, if you go to the US, even bats sleeping in your room, not even bitten you, not even licked you, but just bat is found in the room, they are worried about it. Bats in US and bats in the Western world, they can transmit rabies. But if you look at in India, even Nipah cases are reported in India. A lot of bats are circulating, but still Indian bats are not carrying the Lysa virus in the mouth or in the saliva. So bat in India is safe. Birds are safe. Rat is safe. Squirrel is safe. One more person is safe, that is humans. Human bite usually won't transmit, but certain exceptions are there. So mostly it is mammals, all mammals, particularly wild animals is possible, but rodents like rat, squirrel, birds, and in India, bats is also not a risk factor. But if you read the USMLE, they mentioned bats sleeping in a room. Bat found in the sleeping room, they need to take ARV prophylaxis along with immunoglobulin. So the first part is what sort of animal I'm dealing with it. That is most important thing. Whether the animal is a provocation or non-provocations, whether vaccinated, non-vaccinated, whether it's a puppy or kitten, not at all important for me. What sort of animal, that is most important to me. And second sort of thing is this person is a Swiggy delivery job. While delivering the things, he got bitten, not bitten, scratched by a nail. That's what I discussed previously. No bite, no bleeding, only scratch mark is present. Taken ARV and TT 6 months back for a cat bite because he's a delivery boy. Wherever he goes to deliver, some animals start biting or scratching him there. What will you do now? 6 months back only he has received ARV. Can he start a full courses of ARV? Or only just 2 shots is enough? Plus, he need TT or not. Last time TT is taken, but 6 months is over. Wash the wound. Sorry for the spell check. Wash the wound. And just counsel the person. You already taken the vaccinations, already completed a TT. Do anti-rabies IgG levels, whether it has got any value. So here the point is what sort of category of wound, that's most important thing. Other parts we'll discuss a bit later. So I just want the participants go ahead and put in the chat box so that we can discuss. So what sort of category, whether this person need or not. The first part of your assessment, what sort of animal you are dealing with it. Second part is what category of wound. Usually the classification is when the skin is intact. This is called category 1. Just licks or handling the animal, just you're combing the animal, but there is no lick, nothing. That is called category 1. Category 1 wound just needs washing. There's no need for any prophylaxis, no treatment also. Category 2, scratch. That's why I told even the nails carry the virus. Even though the saliva only contains the virus, but most of the rabid animal, they behave abnormally. They start licking the nails. By licking the nails, the virus can stick to the nail. Once it scratches with the nail, even the nail scratch also can transmit, provided the animal is rabid. How come we know the animal is rabid or not? I'll show how to find out the animal is rabid or not. The third category is a bite. Bite, that the bleeding is happening, definitely it's category 3. So these are all the 3 categories of rabies bite. So when a person is bitten by a mammal and the person is not knowing the history whether the animal is rabid or not, but the category of wound is going to decide. Category 1 does not require any prophylaxis. Category 2 and category 3 needs prophylaxis. So these are all the category. Category 1 is very difficult to find out. In fact, it's very difficult. Most of the time, category 1 can associate with some category 2 or some category 3. When category 1 alone is very, very difficult in the practice there. I'll show this is a WHO algorithm. So we need to know whether the skin is intact or not. Skin is broken, but there is no bleeding is category 2. Skin is broken and bleeding or mucous membrane exposures considered as a significant one. So we need to know what sort of animal we are dealing with it and what category of wound that is more important. One more parameter is an assessment. I'll show a bit later part of my presentation there. So this is how we need to decide. This is a category of algorithm I'm going to show in the last part of my presentation there. So this is category 1, no skin is intact. This is category 3. Already the bite mark is there. Category 3, this is category 2. And this is again category 3. Horse bite and all wild animals, even though that category 2, scratch or whether nail just present, but belong to category 3. Wild animals we consider as category 3 because their teeth are a little bit sharp. And this is category 3. So these are all the wounds we need to remember what sort of wound I am dealing with it. Then this is one of the common questions. People say, in my locality, your dog is behaving abnormally, rabid. It starts biting not only the people, but also on cow. And cow dies within 10 days. But people start drinking the cow meantime without knowing whether the cow is bitten by a rabid dog or not. What do you want to do? Now people are in panic mode because the cow is dead and bitten by a rabid dog. Can give PEP to all people, post-exposure prophylaxis, or no PEP, only those who consumed unboiled milk, or only those who are immunocompromised, only those who handle the raw milk, the person who handled the milk, he needs to give vaccinations or not. So this is a common question people are asking, how the rabies is transmitted. I told them by means of bite, by means of scratch, by means of lick in non-intact skin or mucous membrane exposures. People handling rabid animals, brain or nerve tissues without having proper PPE, yes, personal protective equipment, chances are there. But what about cow's milk? Usually, milk is boiled. Once you boil the milk, the chances of getting the virus alive is very, very unlikely because this virus is easy virus to die. Even boiling the milk can kill. Second thing, even people say unboiled milk and consume it there. Unboiled milk, if you are consuming it, the gastric acid will kill this virus. This is not transmitted by eating the meat or eating the milk or drinking the milk. It's not going to happen. So unconsumed milk or unboiled milk, even if you drink, it's not going to transmit the rabies to you. There is no literature data showing by consuming a milk the person has got rabies. There is no literature case. So these things is not required. And people say the person who drawn the milk, the risk is there. Unless he got the cuts and cracks and the animal is rabid, the chances is theoretically possible, but practically it also not having to happen. Chances of having cut in the hand is very unlikely, and the chances of transmitting that point of time is very, very less. But practically it's not going to happen. Theoretically, yes, very small risk. Person who handled the milk having cuts and cracks, the chances are theoretically yes, but practically it won't happen. So if you see the risk because of the boiling and because of the gastric acid, if you consume the meat or consume the milk, it is not going to transmit the infection to you. Then people want to know, so who are all the risks? Any mammals, bite, scratch, lick, mucous membrane exposure needs it. Depends on category, particularly category 2 and category 3. Depending upon the vaccination status of the host, I'll come back and explain vaccination, not vaccination status of the animal. Vaccination status of animal is immaterial. Provocations, unprovocations is immaterial. So other questions people always want to know. I finished first part. What sort of individual needs rabies prophylaxis, I told. Second thing, people want to know how to handle the wound. For example, this child was coming from the school, bitten by a stray dog. Actually, the dog catch hold of the face of the child, dragged for a couple of feet, even bitten in the scalp also. Immediately taken to the local PHC. The PHC doctor, because of the bleeding, immediately sutured. The question is whether I can suture it because it's profusely bleeding. And since it's a female child, lot of bleeding happening in the face and bleeding happening in the scalp. So the PHC doctor does not know how to stop the bleeding, so immediately sutured it. So the question is, does he suture? And rabies wound to suture or animal bite wound to suture or not? People are asking. So go ahead and vote. We need to discuss. Yes, I want to suture it. No, maybe, I do not know. Please go ahead and answer so that we can discuss at the end. And this is one of the bullock has bitten her, this lady. Again, this is also profusely bleeding from the scalp because the area is vascular area, lot of bleeding happening. What will you do? Come to you within 1 hour. What will you do now? Whether you want to suture or whether you don't want to suture. And even bitten in the ear part also, what you want to do, whether you reconstruct the ear or whether you don't want to leave it. So these are all the practical cases we've seen across. Please go ahead and vote. If you read the guidelines, what it says, usually no, don't do suturing. But if the bleeding or deep or cosmetic reasons, yes, we can suture. Ideally do the secondary suturing, try to avoid primary suturing. If you want the bleeding or if you want to do the cosmetic reason, that's fine, secondary suture can do. But to stop the bleeding, yes, we can suture, provided we need to inject the rabies immunoglobulin into the site and wait for the rabies immunoglobulin minimum half an hour to 45 minutes to go and act, then you can suture it. In cases of special situation, not for everybody, not for minor wound, these are all the indications. If it is deep, yes, we can. And second thing, for the bleeding wound, yes, or very rarely for cosmetic reasons, young female bitten on the face or something there, they don't want to have the scar on the face. That point of time, yes, we can do. Secondary suturing is preferable. If you want to suture, loose sutures, not a closed one, not a tight one. Use of loose sutures, but before that, inject the immunoglobulin. That's most important thing. Otherwise, how the wound should be handled, wash the wound for 15 minutes on the running tap water. With soap, without soap, that's fine. Washing the wound with the running tap water, that's the most important thing. Category 3 wounds needs biological therapy in the form of immunoglobulin. And this is another interesting case. That is why US traveler coming to India, they are taking vaccinations. And the person went to the temple, bitten by a monkey. In the hand, skin breached. Bite mark was seen. So monkey bite, category 2. Unfortunately, I didn't put the slide here, picture here, sorry. Bitten other 2 people also. So what will you do for monkey bite? How are you going to deal? Whether similar to the dog and cat bite or whether similar to the wild animal, monkeys are different. What are going to do? I say TT, anti-rabies vaccines and immunoglobulin. Watch for 10 more days. I'll come back to this watch rule. And ARV plus RIG plus TT plus acyclovir. Why I put acyclovir? Any thoughts on the chat box? Please put it. Above plus antibiotics or refer. Monkey bite needs a little bit more experiences. Refer to somebody who handled the monkey bites. Please go ahead and put in the chat box so that we can discuss. So monkeys can transmit one virus called herpes B virus. This is not herpes simplex. This is not hepatitis B. This is herpes B virus. So chances of transmitting a herpes B virus is high. So we need to give not only the TT, not only the ARV, not only the RIG, but also acyclovir. That is required for monkey bite. Particularly people going to the temples bitten by the monkey, we need to aware of this herpes B viruses that can cause infections and can cause us. Most of the time asymptomatic this animal. This is not herpes simplex. This is herpes B. So usually certain organisms carry certain bacteria. For example, Pasteurella multicoda, dogs and cats, but mostly dogs carry the Pasteurella. Capnocytophagia is a bacteria carried by cats most of the time. Similarly, Spirella minor, that's carried by the rat. But rats come back and told this is not going to transmit the infection to you. Rats, squirrels are not going to transmit, but rats can carry the bacteria called Spirella minor that can cause infections, affect the joints also. Most of the oral cavity contains anaerobic bacteria. Some amount of staph aureus will be there. So we need to know what organisms are present when the animal is biting you. So don't think ARV alone is required, TT alone. We need to think about antibiotics. Again, antibiotics, most of the antibiotics when the wound is deep. When the wound is deep, when the wound is in vascular area, for example, scalp, and the wound is in scrotal area, where the vascularity is very high, the chances of getting infection is very high. So we need to give antibiotics. Similarly, the person is bitten by a cat. Cat has got more sharp teeth. So the depth of wound is very difficult to assess compared to the dog bite. So we need to give the vaccinations. We need to give antibiotics. The threshold to start antibiotics is bit low for cat compared to the dog. Dog, because the teeth is little broader, the depth won't be that great. But cat has got very sharp teeth. Depth of wound is very difficult to assess. We need to give antibiotic prophylaxis for cat bite most of the time. What is the preferred antibiotics? Amoxicillin will work for most of the organisms that is transmitted by the bite, except few organisms. That point of time, whether you can supplement with clindamycin or cotrimoxazole, that's more important. When the rule for rabies in TT, usually people take every 6 months tetanus toxoid. Every 6 months is not required. If you completed your primary schedule of vaccinations for TT in a childhood, what we need to do, take TT vaccinations once in 5 years to once in 10 years, depends upon what is your last tetanus dose. Ideally once in 10 years, but minimum once in 5 years. So don't go every 6 months and take it, that's not required. But all animal bites, including rat bite, they need TT, that's most important. Rat won't transmit rabies, but rats can transmit tetanus to you. So we need to do tetanus prophylaxis for rodent bite also. So that is more important, keep in mind. So for a bites, we need to think about antibiotic, particularly when the wound is deep, when the wound is a vascular area, or the depth of the wound is very difficult to assess, we need to give antibiotics. Certain animals like monkey bite needs, apart from the antibiotic, viral agents called acyclovir is required, and TT is required for most of the bite, including the rodent bite. That depends upon your primary vaccination schedule. So this is another interesting stuff. She's an IT employee working coming late night, bitten by a cat. Bitten by a dog now, but she has bitten by a cat 6 months ago. She has completed 5 doses of ARV and TT also. But that point of time, she has not taken any immunoglobulin. What would you do now? How many says full ARV again I want to give? 6 months is over. Take TT plus ARV plus immunoglobulin also, because she has not taken any immunoglobulin in the past. Clean the wound, watch the animal for 10 days. Check anti-rabies levels, IgG. Suture for species, got a little dead wound, I want a suture, but this is not on the face, this is in the leg. But somebody has sutured it. We see proposally, somebody sutured it also, as you can able to see. This is a referred case for us. So what are going to do? The rule people want to observe 10 days. Where is the 10 days rule? Most of the animal, when they start biting the people or start behaving abnormal, already the animal has got rabies. Once the animal has got rabies, the chances of survival is not more than 5 to 7 days. That is why if the animal is biting you, we need to observe the animal for 7 to 10 days. But what animal the rule apply? Usually the rule applies to dogs and cats. The data is good for dogs and cats. When the animal bites you, particularly the dog or cat bites you, if you are able to observe the animal for 7 to 10 days, and the animal is alive for more than 10 days, the animal is not having rabies. People say incubation period. Incubation period is different, but the animal is having rabies is different. So don't confuse the incubation period with rabies in the animal. How to find the rabies in the animal? Observe the animal for 7 to 10 days. If the animal is more than alive at the end of 10 days, the chances of rabies in the animal is practically zero. Particularly the rule apply to dog and cat, but some people say we can apply to the rule a little bit more extend to 14 days for other animals like monkeys and other things, but there is no data. Data is for dog and cat. If you observe the animal for 10 days, animal is alive, no need for anything. But till the time, we don't want to take chance, so we give patient need to give ARV 3 doses, 0, 3, 7, and observe the animal. That's most important thing. I'll come back to the other part, immunoglobulin and everything. So people want to know what sort of vaccinations intramuscular is standard. Most of the private practitioners are comfortable in giving intramuscular. So what is the schedule? 0, 3, 7, 14, and 28. This is an Indian guideline schedule. But if you see the Western data as well as WHO schedule, even intramuscular, 4 doses equal to 5 doses. Why the study came 4 doses equal to 5? US faced a huge shortage of anti-rabies vaccine. So they CDC compared 4 dose schedules versus 5 dose schedule. They find there's no differences. So nowadays, most of the Western data, Western guidelines says post-exposure prophylaxis, even intramuscular, 4 doses, 0, 3, 7, 14 is enough, or you can give 0, 3, 7, and 28. 14 also you can skip and give 28. That's also possible. But if you know the animal, if you follow the animal for 10 days and the animal is not having the rabies, you can stop at 0, 3, 7. That's also fine. Then one more comment is come intradermal. Most of the government sector, public hospital sector, they are giving intradermal. Why? Because the amount of vaccine required is 0.1 ml. So there is no need for major things. So we can get away with intradermal vaccinations. Only 4 days, 0, 3, 7, and we need to give 28 days instead of 14 days. But each time I need to take 0.1 ml and 2 cells I need to inject. How to inject, I show in a bit. But people asking whether intradermal is equal to intramuscular. Yes, intradermal is equal to intramuscular, but only thing the technique we need to master. Intradermal needs good technique, otherwise the failure chances are there. Lot of paper comparing intradermal and intramuscular, same only there. So can we interchange? For example, the person gone to the government sector, they given intradermal and come back to you for second process. Can you change? Yes. Data shows we can change intradermal to intramuscular. Similarly, government hospitals, they given one vaccine and you are getting a different vaccine. We can change, usually try to finish it off If you are not able to finish it off, you can change the vaccines also. This is another practical tip for you. You can change the vaccines also. Nothing wrong in it. Then we need to know, can I change the brand? Yes, that's what I'm discussing. Brand you can change. Intradermal we need to master. If you master and given intradermal vaccinations, you can try. Otherwise, go with intramuscular. But the most important thing, never give in gluteal region. If you give vaccines in the gluteal region, because of the gluteal fat, it won't absorb. Only deltoid. If anybody given the first shot in gluteal region, don't consider there is a shot. We need to repeat and ignore the first shot. We need to repeat the schedule. That's most important thing. Only in deltoid, children anterior lateral part of the thigh. It is not gluteal region. So people want to know what are the vaccines. 3 vaccines. Usually diploid cell vaccines is not available. Human diploid cell. Usually purified, the PRCV is only available right now. This is available right now. So this is the vaccines. So time period, people want to know. People always want to confuse with the incubation period and rabid animal. Usually the incubation period is very long. Depends upon where it is bitten you. People bitten in the face, the incubation period is short. Bitten on the leg, the incubation period is longer. Why? The rabies virus transmits very slow. Even it stores only hardly 5 to 10 micrometers or by 1 day or something like that. Transmission is very slow. That is why we got a lot of time. Even when the person comes to you, the person is not followed the animal. The person followed the animal 10 days is over, an animal is alive, no need for vaccination. But if the person is coming back after 15 days or 20 days and coming back and meeting you, we do not know the animal status, better to give the vaccinations. There is no upper limit for vaccination timeline. That is most important because the virus goes to the brain very slow. On the other hand, face also the incubation period is average 2 months is average time, but it can vary up to 1 year or even 8 years also. Data is there in the internet share. Then people want to know previously vaccinated, what is the status? Previously vaccinated and 3 months over, 2 doses only required, no need for rabies immunoglobulin. 1 shot of vaccination is completed, no need for rabies immunoglobulin. 3 months it is valid. But if you see the literature, the effect can last for up to 2 years. Particularly all veterinary doctors, they take hepatitis B once in 5 years. They take rabies vaccination as a pre-exposure prophylaxis once in 2 years without bite. But this is pre-exposure without bite. But even then, when the veterinary doctor faces some bite, after taking the pre-exposure vaccination, they need to take 2 doses after 3 months. That's most important thing. Whether you completed the pre-exposure, whether you completed the post-exposure previously, 3 months is over, take. Other options, we can check the anti-rabies immunoglobulin titer level. If it is more than 0.5, there is no need for vaccination. That is other possible, but unfortunately, it is not available freely. It will take time. That is other problem we are facing. So this is the people keep on asking. The Kerala child, everybody read, taken the vaccination. Despite vaccination, the child has died with the rabies. Why? Why the child has died? Because of the vaccination. Still vaccinations were given, but the child still died. Whether delay in giving the ARV, or wound was not washed, or whether given in the gluteal region due to some other cause, rig was not given. I don't know why the child has died. The real reason we do not know. Only we can postulate now. This is a beautiful gap. If you see, if you give the vaccination 0, 3, 7, the immunity starts happening after 15 days only. The first 15 days, if you want to build immunity, we need to give immunoglobulin, whether immunoglobulin or monoclonal antibody. Because this vaccine takes some time to produce antibodies. These are all not live vaccines. These are all field vaccine. That is why pregnancy is not a contraindication for ARV. But the problem is, field vaccines produces immunity little longer. By the time if you want the protections, we need to give the vaccinations along with immunoglobulin, particularly when the wound is category 3 wound, definitely. Wild animals, even category 2 needs immunoglobulin. When it's in doubt, better to give immunoglobulin or at least monoclonal antibody. There are 2 immunoglobulins. One is called equine based, cheap, but we need to give 40 international units per kilogram of the body weight. Other is called human, 20. Efficacy wise, both are same, but anaphylaxis can happen with equine. So we need to observe the persons for 30 minutes to 45 minutes for immediate type 1 anaphylaxis. Monoclonal antibody, slightly cheaper compared to the human, but costly compared to the equine, but efficacy wise same. It is DNA technology, adequate supply because immunoglobulin is not available freely. Particularly human immunoglobulin is not available freely. Production cost is also a bit less, and we can give only 1 shot. That's most important thing. Immunoglobulin or monoclonal antibody, only 1 shot. We need to give at the site of the bite, not at the site of the deltoid. Give at the site of bite itself. Most of the injections, suppose the bite is too small and the immunoglobulin or monoclonal antibody volume is more, we can give in the opposite arm. don't give in the same side. For example, if you're giving the vaccine on the left hand, give either on the right hand or given the gluteal region, immunoglobulin, but not the vaccines. Vaccines only delta. Immunoglobulin can be given or monoclonal antibody can be given in the gluteal region, provided if you don't have access to the site. That's most important thing. This is an Indian study conducted from the Uttar Pradesh. They have demonstrated monoclonal antibody is equal to rabies immunoglobulin. That's most important thing. So this is my last case here, intubated, came with some abdominal pain. Then he suddenly started behaving abnormally. He became aerophobia. Unfortunately, I don't want to place the video because it does hide his personality. So what will you do now? How many say I want to follow Milwaukee protocol or favipiravir or new molecule, something available in the market, or arrange a prayer meeting and arrange the families and tell them there. Or you can refer, otherwise the person starts biting you also. That's another problem. So what are you going to do now? So there are two forms of rabies. Everybody know paralytic form as well as aggressive form. The paralytic form is less compared to the aggressive form. And hydrophobia is one of the manifestations reported commonly happen. Then people say about the Milwaukee protocol. This data I analyzed from 2004. This is one of the failure protocol. Hardly few people, only few countable numbers of the people only survived following Milwaukee protocol. That means keep the persons in general anesthesia, try some antiviral agents like ribavirin or something, but it's not saving the people. Now one of the companies is manufacturing good agents called homoharringtonin, but it's not coming to the market. This is going in the phase 1, phase 2 trial. We need to look for this molecule. People want to use favipiravir. Again, the favipiravir, the data is not good. So as far as the rabies is concerned, still there is no good treatment available. That's the bottom line. That is why in your examinations, the good examiner will tell the prognosis of your exam results in the exam itself. They ask the last question, what is the prognosis of rabies? If you say that question comes from the examiner to you, your prognosis is bad, you're not going to make it in these examinations. Keep in mind. So rabies still has got no role. All other things is failure only. That's a bottom line. So what happened to this person? During the admission, he started bitten other people. For example, the nurse providing the care bitten the nurse. The bite mark was there. So what are going to do now? And we got a lot of secretions. Somebody intubated, somebody given the suction in the secretions. What are you going to do? I told humans is not going to transmit the rabies. Yes, but this man is not. This man is a human, but it's a rabid human. So what are you going to do? So this is a special situations. That is why rabies persons, carnia, transplants, if you do, chances of getting rabies is high. Human can transmit provided he need to have the rabies. As I told earlier, rabies affected person particularly start behaving abnormally, he is not going to live longer. So this person bitten you. So I need to do risk assessment. So this is a rabid person, category 2, category 3 bite I need to do. The housekeeping fellow, he came and told, I did the environmental cleaning, a lot of secretions are in the pool, in the floor, but I don't give it there. So people who are intubated without proper PPE, yes, I need to give it. People who was bitten by this person, yes, we need to give PPE. Humans also rarely can transmit the rabies, only provided the person carrying the rabies virus. So yes, possible, but we need to wear appropriate PPE. For example, face mask for intubating, goggles, yes, it can protect you. But if you want for bitten person, yes, theoretically it's possible. We need to protect the person there. And this is a protocol of the WHO. I'm concluding a couple of slides there. This is a protocol came in 2024 by WHO. We need to know what sort of animal, whether it's a mammal or rodent, and whether the bite is category 1 or category 2 or category 3, whether the person is vaccinated post. I'm not talking about the animal, I'm talking about the host. You are taken vaccinations in the past or not, and what is the timeline, 3 months or more than 3 months, and whether the animal is traceable for next 10 days or not, particularly for dog and cat. And this is a simple one, whether domestic or wild animal. Wild animals always put category 3. Domestic animals depends upon the category what I shown, and we need to do 3 things. Category first thing, we need to take care of the wound. That's most important thing. Wash the wound. Second thing, all needs ARV provided the bite is category 2 or category 3. And third step is we need to think about immunoglobulin, think about antibiotics, think about TT also. This is a step given it. And usually I put a algorithm book says that what we need to do, this patient need PEP, identify the red flag signs, the depth of wound and everything, focus history, wound management, rabies. People always say this helicopter is a genomic, history taking, examinations, liberal cleansing, irrigations, closure, operative, tetanus toxoid, elevations, and rabies risk. But we simplify. This is a bit difficult. What we did is what is an approach we are suggesting. What do you mean by what? W stands for wound. All wounds needs proper care. We need to wash the wound. Whether it's a rodent, whether it's a mammal, whether it's a human bite, we need to wash the wound. That's most important step. Antibiotic, if the depth of wound is great, for cat bite or wild animal bite, yes, we need to provide antibiotics. Amoxicillin granulonic acid is a better drug. Rabies prophylaxis only for mammals, not for rat, not for squirrel, not for normal human being. Because during the class fights, school children bite each other. For them, there's no need for ARV prophylaxis. TT for all, provided if the person has taken TT in the last 10 years, it's not required. Others, like for example, dog, think about capnocytophagia. Cat, think of Pasteurella multicoda. For rat, think of S minor or Spirella minor. Monkey, think of HBV virus. Human, the chances of hepatitis B virus is more. HIV theoretically possible, but practically it won't happen. But rabies is not possible unless the person infected with the rabies. So this is called the WAT, wound, antibiotic, rabies, and tetanus, and others also we can put it right now. Those who want to learn more and join this Vista Virus group, they are coming with newsletters and other things there. They are working on it. So please scan this code, fill your details, because a lot of non-medical people are joining. So we are streamlining our group. So that is why we are putting this one. I thank sincerely Dr. NP Singh. And this is a book we wrote a couple of days back and we circulated during our CME last time. It is algorithm, 15 algorithms ready, out upwards, fever with rash, fever without source, UTI, pneumonia, everything is there. Those who are interested, send a WhatsApp message. We can provide you also. Thank you for the wonderful opportunity. Any questions, I'm happy to take.
Thank you, Dr. Suresh, sir.
Yeah, sir, you can stop sharing, sir. So
Yes, I stopped.
because the chat box is loaded with. So Dr. Bhanu Pratap Singh, our Dr. Pratik Swaraj from the Surat has also joined. Welcome you all. Dr. Pratik, welcome. So Dr. Pratik, can you see the chat box? Yeah, there are so many questions. Can you read out so that we can discuss?
Yes, absolutely. Thank you, NK sir, for inviting me. And I know Suresh sir. I have heard his lecture in SeatsCon and also on YouTube also. And sir, I'm a big fan of yours. And your today's lecture was absolutely treat. And you covered all the questions which we usually get on phones. That I'm been bitten by cat, I'm bitten by dog. What to do? So excellent case-based scenario you've taken. So, sir, I'll just take a question from the chat box.
From Dr. Bharat Reddy, you can see. Can you see that or should I?
We are not able to see.
Sir, I'm not able to see the question.
So Dr. Bharat Reddy is asking, do we need advice to take TT shot for all who has taken the TT shot previously and 6 months has been passed and not sure previous immunization status?
Okay, come again, sir. Your voice was slightly breaking.
Yeah, sir. He is asking about the TT shot, tetanus shot for all those who has taken the shot previously. Suppose he has taken previously and 6 months has been passed. Tetanus toxoid has taken and 6 months has been.
Okay.
So
So
that-
the rules, since I mentioned it here, when the person completed the primary schedule of vaccinations, and there is no need for every 6 months you need to take the TT. That is a myth. Most of the people are following it up. We need to rebooster only once in 10 years, but primary schedule should be completed. But even the primary schedule is not completed. You have taken a TT vaccinations in the past minimum 5 years. There is no need for any TT in the next 5 years.
Yeah, fine, sir. So Akash, do you see the questions?
Oh, I'm not able to see any questions.
Oh, but there's lots of question has been posted. I think Arcel, can you read out the second question?
Yeah. So the second question it states, sir, can you stop post-exposure prophylaxis if the biting dog remains healthy after 10 days?
I told you clearly, the data shows the rabid animal will die within 7 to 10 days, and there is no need to give prophylaxis when the animal is more than 10 days. That's what the WHO algorithm, I've shown a couple of slides before my end of presentations, clearly shows you the animal is traceable, and this rule applies to dogs and cats. Other animal, I can't apply the rule because there are no data, but for dogs and cats, the data is there. WHO also endorsing, observe the animal, but during the observation, don't take chance, give 037. If the animal is alive, further doses of vaccination is not required. Even you can wait for immunoglobulin also up to 7 days. When the animal is alive for 7 days, there is no need for immunoglobulin also. But before that, if the animal dies, you can give the immunoglobulin up to 7 days after the bite.
Thank you, sir, for the explanation.
Yeah, go to the next. You also name the doctor who is asking.
Yes, sir. So I couldn't see the name of the doctor, but I could see the question.
is one Dr. S. Ragaranjan from Coimbatore. I think he already answered. So Dr. S. Ragaranjan, whether the horse bite needs vaccination.
I think we have answered the case what I told. All animals, all mammals can transmit the disease except the rodents. Yes, it needs also vaccinations. TT, along with if the bite is significant one, give immunoglobulin also.
Yeah. So Dr. Sanjay Kumar Singla from the Patiala, with a proper format, we need to see what needs to be seen, and it makes a lots of difference in the management. I think he's just making a comment.
Okay.
Yeah.
So one more question is there from Dr. Aditya. He says that what if a human infected with rabies bites a healthcare professional during care? Should he be given IGs?
That's the last case I shown. That's a real case only. When we admitted the persons, because of the abnormal behavior, he start bitten the nurse who provided the care to him there. So he's bitten in the hand, forehand, he's bitten in it. So we did the literature search, we did the risk assessment. According to the data, yes, bitten by somebody with a rabies, yes, we need to give the prophylaxis. Even though the school children bite each other, that doesn't require rabies prophylaxis. But here the person is admitted with a rabies, bitten a staff nurse, and the staff nurse forearm. So he does not wear any PP at that particular site. So I need to give the vaccinations. But what happened? People are panicked. I provided like environmental cleaning of the room. I just came and checked the BP. People keep on telling it there. So we did the risk assessment. The anesthetists who intubated, even though he was wearing a face mask, he was not wearing a goggle. And nurses who did the suctioning for the persons, again, they also wear the face mask. They didn't wear a goggle. So this type of close contacts, almost 30 people we identified. Totally 84 people provided the care to the persons for 2 to 3 days. But 30 people close contact, they provided exposure. So we did the line listing and provided vaccinations for this 30 people out of 84 people who provided care to him there.
So, sir, there are a few questions came in the CME India WhatsApp group. So, the first is rabies vaccine needed for a category 2 bite if the dog is vaccinated and under observation?
He told us that the vaccination history of the animal is not important. According to Indian guidelines, the vaccination is not the source we are going to protect you there. So we need to observe the animal. Provided the animal is alive, there's no need for vaccination. The history of vaccinations in the dog cat is not going to help us.
And now, sir, what is the protocol for a fully vaccinated person within 3 years who gets a new category 3 bites?
That's also we answered in the question section. If the person has taken the previous vaccinations, whether it's the previous 5-dose vaccinations, 4-dose vaccinations, or even 3-dose vaccinations, bite happens subsequently after 3 months. We need to give only booster shots 0, 3, 2 shots only required. No need for immunoglobulin.
Sir, what is should be done if the rabies immunoglobulin is not available within 24 hours of the bite?
I told them up to 7 days we can give the immunoglobulin. There is time limit is there. Even though the graph I mentioned, the immunoglobulin can work up to 14 days, but we can give the immunoglobulin at the earliest. That's what required. But if you are not able to get the immunoglobulin, monoclonal antibodies also are available. The last resort, one of the paper I read it, we can give the intradermal vaccination that is more effective, provided the technique is good. Compared to the intramuscular, if you do intradermal, the antibody production is little faster and get protective also. That is option plan C. Plan A, try to get the immunoglobulin or monoclonal antibody at the earliest. If you are not able to get the earliest, you can start within up to 7 days. If not, the third choice is you can use an intradermal instead of intramuscular. That is also going to save you.
Thanks. The next question is, what is the correct approach if a patient misses a dose in the rabies PEP schedule, like suppose on day 3 or day 7? Then what to do? Suppose he is
I'm not able to get it there. Pratik, can you hear me? I'm not able to get it. No problem.
So if the missed the dose of the suppose
Okay. Okay. So usually like what happened is 037. The first 2 doses, the gap is too short. Even if the miss we don't consider, usually the time gap we consider from the dose the day what he received it there. For example, 0 is taken and he come back on day 4, day 5, we'll administer them. From the date only I'm calculating for the next dose.
Sir, what is the status in the pregnancy and lactation? Should you give or not?
I told sir, I answered that this is a killed vaccine. This is not a live vaccine. There is no contraindication. Rabies is more threatening compared to the vaccine-related side effects. Even in the first trimester, it's not contraindicated. Please go ahead and give it.
Yes, sir. One more question is there that suppose the immunoglobulin is still indicated if more than 7 days passed. You told about within 7 days, but if suppose after 7 days, can we give?
Immunoglobulin.
Yes, sir.
Usually the efficacy, what if the person has received the vaccinations, first dose has received, the first dose start producing antibody. Even though I shown the graph, the maximum peak happened on 14 days, 15 days, but the antibodies start forming at day 7 to day 8. After giving the vaccinations, if we give the immunoglobulin, the vaccine-related immunity can block the immunoglobulin. So if you want to give the immunoglobulin up to 7 days, after 7 days, the whatever vaccines we given on day 1 that start producing antibody that interfere with immunoglobulin. So usually we won't recommend it after day 7.
Now, three question by S. Ragaranjan from Coimbatore. If the bite happens in infant, what is the protocol? Infant.
The
Bite.
person become infant there. Any thoughts on the panel there?
Yes, sir. So,
Only pediatrics practice is that Pratik, you do anything?
okay, sir. So, if
No, sir. The rule is like if an infant or newborn, the dose is not adjusted, same thing only there. So
Yeah.
this rule is same. Dose also not modified. So you want to give the same 0.5 ml or 0.1 ml vaccines, whatever, we need to give the thing. There's no dose adjustments for pediatric population. Same thing, same dose, everything. So there's no different compared to adult populations. Only thing the site anterior part of thigh.
I think S. Ragaranjan also asking if doctor treats a rabies patient, what is the protocol?
That's
Suppose
why I said depends upon the risk exposure we need to do. If you are intubating, if you are doing a suctioning, if you are bitten by somebody, yes, we need. Otherwise, just by handling the persons, examining the persons with a stethoscope or taking a BP, that is not a risk of getting rabies. So you just don't take anything there. Just wash your hand. That's more than that.
from Ansuya DS from Bangalore already answered. Pregnancy and rabies, you already told, sir. Sunatha asking from Coimbatore, within 3 months re-exposure bite, what to do?
Nothing, sir. No need for vaccinations, no need for immunoglobulin. Just counseling. If you want to be peace of mind, check your anti-rabies IgG level. That is done in the NIMANS Bangalore, but a couple of laboratories are doing it. But last 1 month, they are getting some shortage of the kits there. So take time. But if you check the anti-rabies titers more than 0.5, you are protected there.
The last question I am seeing, Manoj Kumar Gogai from Assam. A class 3 bite in the finger and you need to give immunoglobulin as a person wound is around 70 kg, unable to give half of the calculated dose in the finger. How and where to give the immunoglobulin?
This also we answer as much as possible at the bite site. If you are not able to give the full doses of immunoglobulin, remaining you can give in a site different from the distant from the vaccine site. For example, you are given on the left hand the vaccines, you can give on the right hand the remaining immunoglobulin, or you can use a gluteal region for the immunoglobulin, not for the vaccines.
So now I'll hand over to Dr. Bhanu Pratap, sir. Do you have got any questions or any comment till now? Dr. Bhanu?
Sir. Actually, this is a common custom, sir, that if the dog or any animal that is watched for 10 days and we have started the vaccination schedule post exposure prophylaxis, I think it should not be stopped even the animal is alive, because this vaccination schedule will act as a pre-exposure prophylaxis for the next time for endemic areas like ours. Any comments, sir?
Dr.
Yes, we
Pratik,
agree,
what's
sir.
your comment on this, sir? Just before you, sir, Dr. Pratik, what's your comment on this question or this comment from Dr.
Sir,
Bhanu?
I want answer from Suresh sir because I don't know about this question.
So this is 037 we need to give it. I agree with sir. That's a very valid point, because after 7 days the animals start behaving abnormally, we lose the golden time. So what we used to insisting during the observation period of 10 days, take 037, observe the animal. The animal is alive, further doses of 14 and 28 is not required. This become a pre-exposure prophylaxis for the next bite. Don't consider partial immunity or partial vaccinations. Even partial vaccinations of 3 doses, next bite there's no need for immunoglobulin. So this is agreed with him there.
Yes.
Dr. Bhanu,
Can
how
I
many
ask a
cases
question?
of rabies? Yeah, well, Dr. Bhanu, because you are from
Sir.
the so how many cases of rabies have you seen in recent past?
Today itself, a patient came to me, a young 22 years old boy, but the bite was over his pants. He was wearing jeans and a stray dog. It was a stray dog which caught him on his foot. But there was no any scratch mark. It was over his jeans he was wearing. So I treated him like category 1 and just asked him to wash. There was no even a scratch mark. As is intact skin is a barrier for rabies.
Dr. Suresh Kumar, many times suppose there is a history of dog bite 1 year back, has not taken the vaccination. vaccination, so has not been taken vaccination. So what to do in that case? Suppose he's giving the history that after
Usually the person bitten by a rabid dog, not taken vaccination, not taken prophylaxis, dead there. So what it indicates, person is bitten by a non-rabid dog, so nothing has worked, he's alive. So we need to consider next bite is a significant bite, take the vaccination this time. Because all bites won't give the immunity to you. If it's bitten by a rabid dog, if you are alive, yes, you are going to have the immunity. But here the person is alive without any vaccination means the animal is not carried any rabies in the body. So we need to consider that is an insignificant bite. Next bite he considers a significant bite, take prophylaxis.
now, Dr. Akash, before you comment, so you ask for
Sir,
the take home.
I have a question for Dr. Suresh.
Yeah.
My question is that it is very frequent that a lot of our patients are bitten by mouse, basically. It may be a wild mouse, it may be a this thing. So, is vaccination required there?
So that's what the
Is there
Indian
any
guidelines I
policy?
quoted you. Whatever the animals can transmit, the risk is maximum. In that they mentioned the rodent population, the risk is very minimal. But as you said, the mouse is big. People keep on asking the mouse is a very big one. This is a look like a wild one or something that is not a domestic one. People keep on asking. Usually the guidelines, what I quoted, we clearly mentioned. Usually it is not required, but on case-to-case basis, they said whether ARV required or not. That's what the guidelines mentioned. But usually it was not required, but the person has got fear, a person has got usually a lot of phobic patients we have seen keep on coming with different stories of bites and everything there. The person has got bitten, we can give nothing wrong in it. The other controversial thing that not touched upon is pre-exposure prophylaxis for India. People talking about controlling the animal population, that's not possible. Removing the stray dogs population is not happening. What is the best strategy? Take all. For example, US traveler coming to India, we need to take pre-exposure vaccinations because all Indian roads contain stray dogs. Immunoglobulin is not available freely. That's other cause. That is why all US traveler coming to India or Pakistan or Nepal, they're supposed to take 2 doses or 3 doses is ideal. At least 2 doses they're supposed to take the vaccinations and coming to India. So that is a rule we are applying. Even Indian Pediatric Association insisting because children start playing with a lot of street animals. So they're insisting all the pediatric populations at least 2 doses of vaccinations. So when doubt is there whether the mouse has got domestic or wild or big or small, if the doubt is that whatever vaccines you are giving, that is a pre-exposure for the next bite. So don't hesitate, give it. If the doubt is there, whether it's a wild one or mouse is big one, yes, please give it. Consider this is a pre-exposure. In fact, we are recommending all Indians pre-exposure prophylaxis is the best strategy to eradicate rabies from India. Though. It's
I think
controversial and provoking India.
Akash, 3 more
sir,
questions. Dr.
sir,
Hemlata answered. So next for Subhash Chandra Bose from Chennai. Why should we watch the animal for 10 days? Any special reason?
Rabid animal will die within 7 to 10 days because once the animal get the encephalomyelitis, that's also encephalomyelitis. Once the animal has got encephalomyelitis, the survival is only hardly 3 to 5 days. In fact, 7 days is maximum, very maximum 10 days. Guidelines insist, WHO insists 10 days, but usually if you see the literature, 3 to 5 days the animal will start. Once it start biting other people, whatever cases I encountered 3 rabies cases in the last 6 months, all people once they start manifesting hydrophobia, they died within 2 days time there. Within 2 days time, they died in there. So I don't think so. The same rule for the animal also. Once the animal has got encephalomyelitis manifestations happening, they will die within 3 to 5 days. At max 7. Very worst scenario, 10 days. That's the rule, sir.
I think last question.
sir, sir.
Sir, rabid dog bite but presents after 3 weeks. Vaccinate or immunoglobulin both? After 3 weeks. Presentation after 3 weeks of dog bite.
I told the incubation period is very long. Even the animal is a rabid, I know the virus is not traveling that fast compared to other viruses like COVID or influenza. This transmission is the rate of progression is not that fast. This is a slow progressing virus. So definitely yes. But whether immunoglobulin, yes, 3 weeks if the person comes, the site will be healed by that point of time. But benefit of that because animal is a rabid animal and bite is a significant one. Give the vaccinations along with immunoglobulin at the earliest.
Excellent, sir. So I think this was.
Sir, one doubt.
Yeah.
Sir, a patient of HIV who was previously vaccinated, again rebitten by a dog, rabid dog, should he receive RIG plus vaccine or he should be
Only vaccine,
vaccinated?
so there's no need
What
for
is
immunoglobulin. Even partially vaccinated, 1 or 2 doses also. People taken 1 or 2 doses of vaccinations that produces sufficient antibody. It takes time to produce antibody, but the person taken 3 months back, 6 months back, taken the vaccination, there's no need for immunoglobulin. So only once you
Sir,
need to take. There's no need for
HIV patient, sir.
Sorry, sir?
Immunocompromised patient.
Immunocompromised person.
Immunocompromised
Oh,
HIV patient.
immunocompromised person is a different ball game. The chances of antibody productions, whether the antibody is going to last longer. Only one indications for the immunocompromised patients. We need to think case by case basis. That point of time, yes, immunoglobulin along with vaccinations required. Otherwise, even partially taken vaccinations, 1 doses, 2 doses, we know that for vaccinations. Immunocompromised, particularly post-transplant, post-chemotherapy, or HIV patients with advanced immunodeficiency, that point of time, the amount of antibody is going to produce is very less. So don't take chance, give immunoglobulin along with vaccinations.
Sir, my question, sir,
Sir.
One from Mumbai, Dr. B. Srikant. Can we give immunoglobulin in category 2 bite if dog has died of rabies?
So come again, sir.
Can you give immunoglobulin in category 2 bites if the dog has died of rabies?
Yes, definitely, because it's a rabid animal. Similarly, wild animals bite category 2, I need to give immunoglobulin. The animal died of rabies, and even though category 2, for the benefit of dog, we need to give the immunoglobulin along with the vaccination there.
Yeah, Akash, can you now ask for the take-home message from our speaker and panelist, and then you can conclude?
So it was a very, very nice and very informative and very precise talk by Dr. Suresh Kumar. I'll request Dr. Suresh Kumar to give a take-home message, short take-home message for the benefit of the audience.
The 3 steps only: assess the animal, what sort of animal, assess the individual, what category of wound he got it, assess the vaccination status of the individual. This is a 3-step. Use the WAT approach. Take care of the wound, think about antibiotics, think about tetanus toxoid required or not, and last step, think about rabies prophylaxis, whether immunoglobulin, vaccinations, or watching the wound. And most important, country like India, if you want to forget about rabies, pre-exposure like veterinary doctors, we need to take 2 doses of vaccinations, forget about the rabies in the mind.
Great, sir. Yeah.
Dr. Bhanu Pratap, please give your take-home message on this talk.
Thank you, sir. Definitely, this rabies has to be treated as an emergency like situation, and proper prophylaxis, proper immunoglobulin, if indicated, is a mild is a what we call a pillar to prevent this dreaded disease.
Great.
Dr. Pratik.
Yes, sir. So I think managing dog bite should be known to all the primary care physicians because they are mostly getting this type of queries. So whatever sir has said very nicely, there are good mnemonics sir has given. We need to follow that in our primary care. And most of the time, patient comes to us in a panic mode. So first we have to make him calm. We have to take detailed history that what kind of animal, what is the vaccination status, and after the careful assessment, the wound care, giving tetanus toxoid, giving immunoglobulin, giving vaccine, should be documented thoroughly. Documentation should be very, very important while managing this kind of patients.
I think we have the important messages from all of our speakers. Shall we close the session?
Yes, sir. You can conclude and propose a vote of thanks.
I thank Dr. Suresh Kumar for a very good talk, and he had the very precise and very accurate answers to all the queries which are posted, which is really important. And the participation and the number of questions which were generated in the talk is telling about the quality of the talk and the message it conveyed. I thank our panelists Dr. Bhanu Pratap Singh and Dr. Pratik Sawaj for actively participating, moderating the sessions, giving in their valuable inputs and their take-home messages, which matter so much to us. I thank Dr. N.K. Singh for being the anchor of these monthly CME meets of CME India and for conceiving and getting such excellent talks delivered on the platform, which is, and the talks are generally attended by 1,000+ doctors. I also thank the USV team for providing the digital platform for our talks. And the last but not the least, I thank all the doctors who participate in these CMEs, who ask the questions, and who make this entire program very, very interactive and informative. So with this, I hand over the session to the USV team, Dr. Arushi, to formally close the session.
Yeah, thank you so much, Dr. Akash sir. Thank you so much, Dr. N.K. Singh sir, for yet bringing to us one another episode of CME India. I would also like to thank Dr. Kumar sir for giving a fabulous talk to all the audience for being so interactive. Thank you so much, our panelists, Dr. Bhanu Pratap sir, Dr. Prateek, and Dr. Akash Singh sir for being there, and tech team for all your support, and my team USV. Thank you so much.
Thank you all. Good night. We will meet again next month. Thank you very much.
Thank you,
Thank
sir.
you.
Good night, sir.
Bye.
Thank you, sir. Good night, sir.